Hi, and welcome to my presentation about the community plan that was developed for Lodi, Wisconsin. This presentation will discuss a particular health need for the community of Lodi, Wisconsin. First, we will start with defining the community. We'll provide information about the results of the windshield survey that was done. We will review the health data for Columbia County, Wisconsin, which is the county that Lodi is located in. Introduce the community partners and resources that were part of this project. What the community health diagnosis is, along with the community health plan, the intervention that's planned for the target community, and how we will evaluate the success of the intervention. Lodi, Wisconsin, or the zip code 53555, is a small community located in south central Wisconsin in Columbia County. It includes the city of Lodi as well as all or part of several surrounding rural townships and part of a village. This is a more encompassing area that better represents the citizens who are part of the school district and population that consider Lodi their hometown and would utilize the services and participate in community activities in Lodi. Some of the data presented will be specific to Lodi, and other data will be specific to Columbia County due to the availability of information. The interventions for this project were based on the premise that the data for Columbia County, Wisconsin is a likely representation of the population of Lodi, Wisconsin. The project was not chosen based on the community survey. However, the survey did give good insight on what resources are or are not available in the community. To summarize what was found in the windshield survey, the community is a clean, safe place to live. There are many services that are available in the community, but there just isn't a lot of variety. The community could use some type of public transportation. There is a primary health care clinic, but it's located near the schools, but some of the housing is fairly far from the clinic, and it would be difficult for elderly people or people with mobility issues to get to the clinic. I determined the most pressing problem in the community was lack of access to social services in the community, and think it would be good to have some type of resource that people could go to for help, whether it be for the elderly or families in need of assistance. It might be beneficial to set up a program with the Aging Disability Resource Center for Columbia County, which is located in Portage. That's about 20 miles from Lodi. That could bring a social worker and possibly a public health nurse to the community at least once a week. And I think a good place for this to happen would be in the community center. When looking at the hospitalization data for Columbia County, it isn't difficult to see that a disproportionate number of adults aged 65 and older had preventable hospitalizations. 689 out of 1,044, or 66% of adults aged 65 and older accounted for preventable hospitalizations. And then out of 604 hospitalizations for accidents, 273 of those were people aged 65 and older, or about 45%. And then 47 out of 56 hip fractures, or 84%, were people aged 65 and older. Additionally, the costs to hospitalize people in the target population are much higher than the per capita overall. As you can see, it's $7,495 per capita for people aged 65 and older, and then $2,781 per capita overall. That's a difference of $4,714, which is a 270% increase in cost per capita to hospitalize someone age 65 or older. I think that this suggests that we need to do better understanding the needs of our senior population and finding evidence-based ways to help decrease their incidence of injuries and hospitalizations. For this project, there were a couple of community partners that I was able to get help from. The first would be Betty Hausman. She is the mentor for this project, and she is my main community partner. She's a retired nurse practitioner who specializes in geriatrics, and she is the head of a program for seniors that is held at the local community center called Reach Out Lodi. And she and her husband put on a program called Wellness on Wednesdays for the senior population, and that includes some type of educational activity once a week during the winter months, or fall through spring, I should say. She has a lot of knowledge about this patient base And by combining her knowledge about this population and her access to that population, we were able to put together a project that can help not only the seniors in the community center, but hopefully other groups within our community, since I plan to present this project to more than one facility in town if I can get permission to do so. And then another community partner was our Columbia County Public Health Nurse, Sherry Genrich. She was able to direct me to additional resources that are available, which I am going to be including in the presentation for my target population. And then some community resources that I tapped into was the Columbia County Aging and Disability Resource Center, the State of Wisconsin Office for the Blind and Visually Impaired, and the University of Wisconsin Institute on Aging. So the community health diagnosis that I came up with based on all of the prior information that we just discussed is that people age 65 and older are at an increased risk of hospitalization or injury caused by accidents due to sensory changes caused by aging, a lack of education about how sensory changes increase the risk of accidents and injuries, and a lack of education on how to prevent falls and other injuries. So my community health plan is to educate people age 65 and older, and possibly their caregivers and or other family members, to help them understand how the effects of aging on vision can increase their risk of accidents and how they can compensate for some of these changes to decrease their risk of injuries. The intervention that I have planned is an in-person presentation, either via PowerPoint or poster board, at our local community center and other community locations. I chose to have both resources because I realized that some of the places I plan to present this may or may not have access to a computer. And then I also would like to present this at we have a local annual health fair as well at one of the local schools. My plan is to educate the audience about how the eye functions and how aging affects the structure and function of the eye, and also how they can make some changes in their everyday life that will help decrease their risk of having an adverse effect from these changes to their vision. I plan to provide handouts with suggestions on those interventions that can be done at home and in their everyday life. And I also plan to provide information about other resources beyond what I am able to provide, including special groups that deal with people who have vision changes. I plan to evaluate the success of this presentation or intervention by doing a short survey at the start of my presentation. And this will ask the audience questions about what their knowledge or perceptions about vision changes are when they age. And then within the presentation, I will have topics that cover the questions that were in the quiz. And I also want to include time for the audience to share any interventions they've already implemented at home that have been successful for them. I think that people learning from each other and sharing their own experiences helps keep the audience engaged, and then they are going to feel like they're part of the presentation. And then at the end of the end of the presentation, I will give the participants the survey again, and we'll see what was different or what they learned that maybe they didn't realize they had a misconception about. And then ideally, I would like to follow up with this group, the same group or as many of them as possible, in 30 to 60 days after the presentation to kind of have a get together where we can discuss some of the things that they had implemented, if they were successful for them or not, and have another opportunity to learn from each other. When developing a program to address a particular health need in a community, it's important for the community health nurse to know the strengths and weaknesses of the community that he or she is serving. It's also important to have data to support the justification for an intervention, as well as to track whether an intervention was successful. The community health nurse also needs to provide the appropriate type of education and resources for the target population to bring about positive changes in the health of that population. The community health plan is something that will need to grow and change as the needs of the community change. Thank you for watching my presentation.